Hello everybody and welcome to Divulgando Ciencia. My name is Gustavo Herzhuber. In this video, I'm going to talk about HIV and AIDS. I'm going to explain you the difference between these two terms. But first, I'm going to ask you to please give it a like, subscribe to the channel, click the notification bell, and share the video. Please follow me also on Instagram. At the beginning of the 80s, there was a condition which was the AIDS. That was an immunodeficiency condition on several people, especially homosexuals. But there wasn't a pathogen known to cause this. It was until 1983 that the HIV was discovered, and it was proven that it's the agent causing AIDS. Welcome to this new video. Some time ago, a diagnosis of HIV or AIDS was considered a death sentence. Thanks to research and the development of new treatments, HIV-positive people at all stages now live long and productive lives. An HIV-positive person on regular antiretroviral treatment can expect to live an almost normal life. HIV is a virus. HIV is a virus that can cause the immune system to deteriorate. The term HIV stands for Human Immunodeficiency Virus. HIV belongs to a group of viruses called retroviruses. The name describes the virus. Only humans can contract it, and it attacks the immune system. As a result, the immune system is unable to work as effectively as it should. Our immune system can completely eliminate many viruses from our body, but this is not the case with HIV. However, drugs can control HIV very successfully by interrupting its viral life cycle. AIDS is a disease. While HIV is a virus that can cause an infection, AIDS, which is short for Acquired Immunodeficiency Syndrome, is a disease. Contracting HIV can lead to the development of AIDS. AIDS develops when HIV has caused severe damage to the immune system. It is a complex disease with symptoms that vary from person to person. The symptoms of HIV are related to infections that a person can develop as a result of having a damaged immune system that cannot fight them as well. Known collectively as opportunistic infections, these include tuberculosis, pneumonia, and others. Certain types of cancer are also more likely when the immune system functions less effectively. HIV does not always progress to AIDS. An HIV infection does not always necessarily progress to AIDS. In fact, many people with HIV live for years without developing AIDS. Thanks to advances in treatment, a person living with HIV can expect to live a nearly normal life. Although a person can have an HIV infection without having AIDS, anyone diagnosed with AIDS has already contracted HIV. Because there is no cure, HIV infection never goes away, even if AIDS never develops. Often, those who develop AIDS are people who have not been tested for HIV and have never taken treatment. Once HIV treatment is started, death from AIDS can be prevented. HIV infection can be diagnosed by a simple test. When HIV is transmitted, the immune system produces antibodies against the virus. A blood or saliva test can detect these antibodies to determine if the virus is present. The HIV antibody test can take several weeks after transmission to give a positive result. Another test looks for antigens, which are proteins produced by the virus, and antibodies. This test can detect HIV just a few days after infection. Both tests are accurate and easy to perform. AIDS diagnosis is more complicated. AIDS is an advanced HIV infection. Healthcare professionals look for some factors to determine if HIV latency has progressed to AIDS. Because AIDS destroys immune cells called CD4 cells, one of the ways healthcare providers diagnose AIDS is by performing a CD4 count. A person without HIV may have between 500 and 1,000 CD4 cells. When the cells have dropped to 200, a person with HIV is considered to have AIDS. Another factor that indicates that AIDS has developed is the presence of opportunistic infections. Opportunistic infections are diseases caused by viruses, fungi, or bacteria that would not make a person with an undamaged immune system sick. HIV does not always produce symptoms. HIV usually causes flu-like symptoms 2 to 4 weeks after transmission. This short period of time is called acute infection. The immune system controls the infection, resulting in a latency period. The immune system cannot completely eliminate HIV, but it can control it for a long time. During this latency period, which can last for years, a person with HIV may not experience any symptoms. However, without antiretroviral therapy, that person may develop AIDS and, as a result, will experience many symptoms associated with the disease. HIV can be transmitted from person to person. Since HIV is a virus, it can be transmitted from person to person like many other viruses. AIDS, on the other hand, is a disease that a person acquires only after contracting HIV. The virus is transmitted from one person to another through the exchange of body fluids. Most commonly, HIV is transmitted through condomless sex or shared needles. To a lesser extent, a mother can transmit the virus to her child during pregnancy. Treatment and life expectancy. If HIV develops into AIDS, life expectancy decreases considerably. It is difficult to repair damage to the immune system at this point. Infections and other conditions, such as certain cancers, resulting from severe immune system impairment are common. However, with successful antiretroviral therapy and some recovery of the immune system, many people with AIDS live a long time. With current treatments for HIV infection, people can live with HIV and never develop AIDS. It is also important to note that successful antiretroviral treatment and a sustained undetectable viral load greatly reduce the risk of transmitting the virus to a partner. As you could see on this video, the main difference between HIV and AIDS is that HIV is the virus causing the disease, which is AIDS, and AIDS is a syndrome. You can have HIV without developing AIDS, but you cannot have AIDS without having HIV. If you like this video, please give it a like, subscribe, and share the video. And follow me also on Instagram. Thank you very much. See you next time.